Hello friends, in this video we'll talk about hamstrings, muscles and applied aspect. So first we'll discuss the muscles that constitute the hamstrings and the applied aspect, okay? First, what are the hamstring muscles? Semitendinosus and membranosus with the biceps femoris. In this we are seeing the semitendinosus and the biceps femoris, okay? So remember that all the hamstrings coming from ischial tuberosity, common origin. Insertion vary, okay? Insertion is different for all the muscles. For semitendinosus, it will insert into the tibial condyle, okay? Or sorry, the shaft of tibia here. Semitendinosus, remember ST, shaft of tibia, okay? And then if we see the biceps femoris, biceps has in two heads. So for short head only the origin is different, that is the lower femoral shaft, okay? Insertion is common, that is into the fibular head, okay? Femoris, F for fibula, head of the fibula, okay? Now let's see the semimembranosus. Here the insertion will be into the medial condyle of the tibia. Remember M as in medial condyle of tibia. Okay? Right. Now we are finding the nerve supply. So all will be supplied by the tibial branch of the sciatic nerve, all the muscles, except the short head of biceps here, that will be supplied by the fibular branch of the sciatic nerve or common peroneal. Please remember this point, common peroneal or fibular, any one of these I say is the same. Don't get confused, okay? Right. And what is the function? Common function is extension of the thigh and flexion of the leg. Just remember this much. Extension of the thigh and flexion of the leg, okay? And we can also find here the clinical significance. Whenever there is a hamstring tear or injury, the person falls forward. Suddenly, when he is walking, there is a sudden hamstring tear, he falls forward. Okay? Right. So let us see the anatomical basis of sciatic nerve injury. So when we are giving the direct intramuscular injection in the gluteus maximus, we are injuring the sciatic nerve. So what we do is, during surgery, what is to be done? We have to give the intramuscular injection here at this point. Gluteus medius should be preferred, that is 2.5 centimeter above the anterosuperior iliac spine. Okay, so in that way you are not injuring the gluteus maximus. Okay, so remember that where is the intramuscular injection to be given? The gluteus medius muscle. Okay. Now the very important Trendelenburg sign. So we can see this very clearly in the figure. So this is a normal pelvis with the gluteal muscles, medius and minimus. This is the normal movement, okay? But what happens in Trendelenburg sign? Sagging of pelvis on healthy side when foot is off the ground. So when we say the patient is Trendelenburg sign positive, when the pelvis is like what we can say, when there is a sagging of the pelvis on one side, that is falling off on either the right side or the left side, okay, then that will be called as Trendelenburg positive, okay. This is important. Alright, so references from where I took the pictures. That brings us to end of the video. So thank you so much. I'll see you in the next video.